In this video, you'll get to know more about us. Drug names. My generic name is Canivaptan, my brand name is Vaprisol, and my chemical name is... Hi, my generic name is Desmopressin, and my brand name is DDAVP and Estimate. My chemical name is... My generic name is Tolvaptan, and my brand name is Sanka. And my chemical name is... Drug classification. In therapeutic classification, Vasopressin as antidiuretic hormone, prostatic stimulant, and hemostatic. Oxytocin as oxytocic and lactation stimulant. In pharmacologic classification, Vasopressin as posterior pituitary hormone and oxytocin as exogenous hormone. My pregnant category is C. Mechanism of action. Vasopressin or ADH, antidiuretic action, control or prevent signs of complication of neurogenic diabetes insipidus. The drug increases CAMP, which increases water permeability at the renal tubule and collecting duct, resulting in increased urine osmolality and decreased urine flow rate. Peristaltic stimulant action used to treat postoperative abdominal distension and to facilitate abdominal radiographic procedures. Vasopressin induces peristalsis by directly stimulating contraction of smooth muscle in the GI tract. Hemostatic action by directly stimulating vasoconstriction of capillaries and small arterioles. Oxytocin increases the sodium permeability of uterine myofibrils, indirectly stimulating the contraction of uterine smooth muscle. The threshold for response is lowered when estrogen levels are high. Uterine response increases with the length of the pregnancy and increases further during active labor. Response mimics labor contraction. Pharmacokinetics. I am rapidly absorbed and metabolized. Available for oral, IV, and nasal administration. Excretion is unknown. Indication. Treatment for diabetes insipidus and hemophilia A. Contraindication. Patient with hypersensitivity, severe renal dysfunction, vascular disease, pregnancy, and lactation. Side and adverse effects. In central nervous system, tremor, headache, and vertigo. In cardiovascular, angina in patient with vascular disease, vasoconstriction, arrhythmias, cardiac arrest, myocardial ischemia, circummural pallor, decreased cardiac output. In GI, abdominal cramps, nausea, vomiting, and flatulence. In skin, cutaneous gangrene and diaphoresis. Other is water intoxication and hypersensitivity reactions. Oxytocin in maternal, in central nervous system, subarachnoid hemorrhage or seizure or coma. In cardiovascular, hypertension, increased heart rate, systemic venous return, and cardiac output, arrhythmias. In GI, nausea and vomiting. In hematologic, afibrinogenemia. In genitourinary, tetanic uterine construction, ambrosio placentae, impaired uterine blood flow, pelvic hematoma, increased uterine motility, uterine rupture, and postpartum hemorrhage. Others, hypersensitivity reactions and water retention. Oxytocin in fetal, in CNS, infant brain damage, in EENT, retinal hemorrhage, in cardiovascular, bradycardia, PVCs, arrhythmias, in hepatic, jaundice, in respiratory, anorexia and aphasia, and other low APGAR score. Nursing responsibilities. Before drug administration, first assess for contraindication or caution to avoid adverse effects. Assess skin for lesions, orientation, effect, and reflexes, blood pressure and pulse, respiration and adventitious sounds, abdominal examination, renal function test, and serum electrolytes to determine baseline status from beginning therapy for any potential adverse effect. During drug administration, monitor patient fluid volume for signs of water intoxication and fluid excess. Monitor patient with vascular disease for any sign of exacerbation to provide for immediate treatment. Monitor condition of nasal passages as given intranasally to observe for nasal ulceration, which can occur and could affect drug absorption. Provide comfort measures to help patient cope with the drug effect. Provide patient education about drug effects and warning signs to report to enhance patient knowledge and to promote compliance. After drug administration, monitor patient response to therapy. Monitor for adverse effects. Evaluate patient understanding on drug therapy by asking patient to name the drug, its indication, and adverse effect to watch for. Monitor patient compliance to drug therapy.